Hello everyone. Today we are going to start with gynecology. Okay, that is unit first. Okay, first unit of gynecology. See, you have 20 hours in gynecology. In that first 2 hours, two units I am going to take, unit 1 and unit 2. So today we'll start with unit 1, gynecological introduction. So first is the meaning. What is the meaning of gynecology? Gynecology is the study of disease of female genital organs. See, in the OBG, what you have studied about the mother, pregnancy, delivery, newborn baby. But in the gynecology, you are going to study about the disease of female genital organs. Next is the definition of gynecology. Gynecology is the medical practice dealing with the health of the female reproductive system like uterus, vagina and the ovaries, as well as the relative pelvic structures. Literally outside the medicine, it means the science of woman. So if you are not counting in the medicine, it will come the science of woman. All the organs of female genitalia, if there is any disease, any malfunction, that you are going to study in the gynecology. So history collection for gynecological cases, if any gynecological disease, if anyone is coming with any gynecological disease, how we'll collect the history. You have studied in the OBG also, okay, like maternal history, first obstetrical history, then the present obstetrical history, okay, that last LMP and all. So if it is gynecological case, how you are going to collect the history? The first one is components of history taking. What are the components it will be included? It will be included general information, okay, cheap complaints, menstrual history, optic history, history of present illness, past medical history, personal history, family history, socio-economic history, and the drug and allergic history. The next one is general information. In the general information, you have name of the patient, age, religion, occupation, husband name, age and occupation of the husband, marital status, address, date of admission, mode of admission, and date of examination. See, this is for normal, for any cases you are going to ask. So it is general information. Next one is history of presenting complaints or chief complaints. In this, what you are going to ask? You are going to ask if there is a pain. In the pain in uterine, that it is a colic pain or felt in the sacrum or groin or in the ovary, which area, site of the pain, onset, when it started, and character and severity of the pain, okay, or associated with any other features like pain, only you have pain, or pain you have nausea, vomiting, any other things, timing, what it started, effects, like because of pain what are the activity you are not able to do it, the relationship and the spread, like if you are having only in the stomach or it is radiating to the legs or chest area. So these are the things you are going to ask in the history of presenting complaints. Next is menstrual history, is very important, it is gynecological cases. So you are going to ask the menarche. Menarche means when the woman got first period, menopause. If woman age is 50 or 60, you are going to ask that when they have stopped, they are getting the periods. The first day of last menstrual period means LMP. Length of the bleeding, for how many days, frequency, regularity, bleeding between the periods, bleeding after intercourse, and any post-menopausal bleeding, nature of periods, it is heavy or clots or flooding. So these are the menstrual history you are going to ask to the patient. Next is obstetric history. So as it is gynec case, obviously they'll have obstetric history. So if it is unmarried, no need to ask, or if the patient is not having any baby, so if they have a baby, you have to ask the obstetrical history also. In the obstetrical history, you have to ask like years and events, means in which year they got delivery, okay, then labor, delivery, how it is, method of delivery, it is normal delivery or cesarean delivery, okay, and the postnatal period, they have any complication or not, and the baby weight during the birth, sex of the baby, and baby was normal or not, then they have given breastfeeding or not, and they have used any contraceptives or not, that everything you are going to ask in the obstetrical history. Next, you are going to ask about the contraceptive history also, like any contraceptive they are using and husband is using or wife, types, duration, or any complication faced by the couples because of contraceptive. Next, you are going to ask the first medical history. That is also normal for any patient. You are going to ask Previously they were having any type of disease, any communicable disease like diabetes or hypertension or tuberculosis, okay, then any other complication like UTIs or STD that you are going to ask. Drug history means you are going to ask the patient they have prescribed any medication, like they are on diabetic medicine or thyroid medicine or hypertensive medicine. The non-prescribed medicine also, like herbal remedies, if they are taking any medicine without doctor prescription, that also you are going to ask to the patient. Then you are going to ask recreational drugs, like some people without prescription they will take the sleeping pills and all, okay, so that also you are going to ask. And any known drug allergy, you are going to ask to the patient that they have any type of allergy to the any drugs. Next you are going to ask about the sexual history. In the sexual history, what you are going to ask? You are going to ask the frequency of sexual intercourse, type of contraception used, any complaints before, during or after sexual intercourse, and dyspareunia, that is superficial or deep. And you are going to ask the family history, that is are your parents still alive or do they suffer from any illness, okay, if dead, what was the cause of death. Like in the family also, if they are having any type of any illness which can be genetic or hereditary, that also you are going to ask to the patient. Next you are going to ask the personal history about the patient's sleeping pattern, appetite, micturition, defecation, weight loss or gain, addiction, then family history, medical condition, gynecological condition, malignancies or consanguinity, okay, so that you are going to ask in the personal history. Consanguinity means if they got married within the blood relatives. Sometimes what happens, like if they got married to some blood relatives like cousin and all, there is a chance that their baby will get that abnormality or congenital malformation, okay, so that also you are going to ask if you are married, if it is consanguine marriage or other than consanguine marriage, okay. Next you are going to ask about the social history, like their occupation, their support network, smoking, alcohol, marital status and ranking. So this is about the history collection of the patient with gynecological condition. So the patient come with any gynecological disease, based on the disease or based on the problem or based on the complaints, you are going to collect the history from the patient. So with this we have completed introduction, definition and history collection of gynecological condition. Thank you everyone.